Dr. Rakesh Mohanlall is someone who has become a familiar voice to us on the Breakfast Rush, a clinical technologist specialising in cardiovascular perfusion and non-invasive integrated healthcare. Doctor has over 30 years of experience in your cardiovascular healthcare. Dr. Mohanlall, who has worked in cardiac surgery nationally and internationally and has now dedicated his career to advancing non-invasive cardiovascular diagnosis, prevention and treatment. Today, the Heart and Health Centre provides an array of different screening, diagnostics and treatments for a wide range of diseases, from children to adults. Doctor, we've missed you. Welcome back to Medical Monday on Radio Ansaar, your breakfast rush.
Thank you very much. It's always wonderful to be on the show and to address the listeners. Thank you for inviting me.
Always amazing to help you. To hear you help us, and so informative. We take away so much. So looking forward to this session as well. Doctor, tell us, what is the Heart and Healthcare Centre about?
Well, our philosophy is very simple. Instead of waiting for a heart attack or stroke to occur, or waiting for some sort of disease progression, we are here to identify potential risks at an early stage, as early as possible, so that we can put systems in place to improve a patient's condition and act proactively, so that the patient doesn't suffer in the long run. We see a wide array of patients, from patients that have established diseases to patients who just want to know what's happening with them, so they understand their life and their health status presently. So they'll be able to put systems in place to actually ensure their longevity. Our approach combines clinical assessments, non-invasive technologies and screenings, and we develop personalized health plans to always make sure that it's tailored to the patient's individual needs.
Yeah. Doctor, many people only visit a healthcare professional when something goes wrong. We often hear the phrase prevention is better than cure. Medically, why is it so important?
That's one of the biggest challenges we all face in life. Conditions like high blood pressure, diabetes, even coronary artery disease develop over a period of time, so over many years. And a person feels completely well until the damage has occurred because of disease progression. We see damage to the heart, damage to the kidneys, the blood vessels, the brain, and all major organs in the body. So by the time we actually see the patient, the symptoms are very, very significant and damage has already occurred. So early assessment is key. It allows us to identify the patient's risk profiles. It allows us to look at their lifestyle and make lifestyle changes and recommend medication should it be required, or further investigation should we see the need for it. Prevention remains one of the most effective healthcare tools in the world, and this is what will improve our quality of life going forward.
Absolutely. Doctor, so people might be a little bit confused because there's so many different heart tests available. How do we know what test we need?
Well, it's always advisable to start with the most comprehensive but straightforward test, which is the biofeedback test. So a full body biofeedback test is a screening tool that will give us an indication of what's happening throughout the body. From the results of these tests, we can then use these results to ensure that we advise the patient accordingly in terms of, again, treatment, medication, scans that's required. I would suggest that people take advantage of this time for the biofeedback test, because until the 9th of August, we are offering the biofeedback test where you pay for one test and you get 50% off the second test. So you can use it for your spouse, your children, or your relatives. So take advantage of that. As we say, it will only be available from now till the 9th of August.
Okay. Who should actually consider having a cardiovascular assessment, Doc?
Well, it should be done by everybody. At the moment, everyone who wants to know what's happening with their life, everybody who wants to move forward in a healthy way should be doing this assessment. It should be done by patients who just want to know about the health status, but also it is very, very pertinent to patients who basically have family history. And this is the strongest thing that's going to dictate your life, your family history, because it's in your gene pool. So patients who have family history of high blood pressure, diabetes, heart problems, strokes, kidney failure, cancer, these are the patients that should be very proactive in doing the test. Also patients who have experiencing difficulty breathing or unexplained tiredness or fatigue where they cannot manage the entire day. they should be looking at this test. And patients, as I said, with a family history of diabetes, a very high cholesterol, high blood pressure or low blood pressure problems, as well as patients who are heavy smokers, obesity, which is a contributing factor in some people. And then patients that have symptoms like shortness of breath, chest pains, gastric problems, back pain that does not go away, pain that's radiating from the chest up to the neck, shoulder, and left arm. These are telltale signs that we're having a serious problem, and those patients should look at or opt for the three-dimensional vasculography or the 3D VG cardiac assessment, which is a much more advanced test in terms of cardiovascular function.
One treatment our listeners often ask about is the external counter pulsation, or the ECP. Can you explain, doctor, what exactly are we talking about?
Well, external counter pulsation is a medical treatment. It's completely non-invasive. It's a treatment that's considered or accredited by the US FDA, which is the medical body for accrediting treatments. So it's accredited by the US FDA, the Chinese Medical Association, the American Heart and Stroke Foundation, the European Cardiology Association, which our South African cardiologists prescribe to. It's also accepted all over the world. And in South Africa, it's accredited by the HPCSA, which is our governing body. We are the only center in South Africa that's HPCSA accredited treatment center for ECP. During ECP, specialized cuffs are wrapped around the legs, and they inflate and deflate in synchronization with the heart. ECP, or external counter pulsation, improves the patient's blood flow throughout the body to every organ of the body. And what it does is it offloads the heart, so it reduces the workload of the heart during systole again. So the machine works during diastole, and it inflates during diastole, and the machine relaxes during systole. It stimulates collateral development in the heart. These are blood vessels that you are born with. They are small natural vessels that, as your epicardial vessels or the natural vessels of the heart start to narrow, the collaterals start to open. So this is your natural bypass, and this is what prevents you from dying of a heart attack. You'll notice that many people have a heart attack and they still survive, and you'll hear patients that have triple vessel disease, but they're still surviving. These are because of the collateral vessels. So if your collateral vessels save you, for example, after a heart attack, then why do you need external counter pulsation? Remember, the collaterals are small in size. And on exertion, the patient will feel they're still having a problem. So what we do during ECP is we increase the blood flow to the collaterals, improve the size of the collaterals so that they can function optimally, even if you have a heart attack or blockages or bypass. So it can be done after stents and bypass surgery. It also promotes development of new arteries, and this is the bioprocess of arterioangiogenesis. So ECP improves the symptoms of chest pains, angina, as you would know, exercise tolerance, and improves your quality of life.
Doctor has treated many patients over the years. Can you perhaps share some examples of how comprehensive assessment and treatments have helped people?
As we say, every patient has his own story to tell. We've treated thousands of patients with unbelievable results. There's so many that we can talk about, but since you mentioned it, one of the recent patients that we can discuss is a patient who's approximately 88 years old. He came to us with heart failure, kidney failure. He was wheelchair bound. He was very frail on kidney dialysis. He could not say a few words without becoming short of breath. Severe shortness of breath. The patient had cardiac insufficiency and heart failure for a period of time. His pro-BNP, which is a marker that we use to check the degree of failure, was over 3,500. That was supposed to be for his age, around 700 or so. After completing ECP, the patient was improved significantly and returned to good quality of life. When we brought this patient, when the patient came here to visit us, he could not walk 10 meters initially because he was wheelchair bound. We had to literally carry him, put him on the machine, strap him, and then unstrap him when we're finished and get him ready, put his shoes on and stuff like that. After 8 days of the treatment, we have a video to show and prove that after 8 days of the treatment, the patient could get off the bed himself, off the ECP machine himself, get himself ready, put on his shoes, and walk to the car. This is 8 days of treatment on an 88-year-old patient who was in heart failure. I don't think that many modalities in the world can show improvement at this level. The other case, that was a fantastic case that we've seen. Another case that I can speak to you about is a patient that was born with congenital heart defect. where the heart was positioned on the right side instead of the left, which is dextrocardia. He also had the great vessels which were transposed, so the vessels were connected on the opposite direction, the main vessels. And this patient as a child went through major surgery and underwent transposition of the great vessels, which is a surgery that we do on patients like that. And he had very good results based on the surgery that he underwent. He was fine till adulthood. And as a young man, I think he was working a little bit of too hard, carried some heavy equipment, and the heavy equipment caused him to go into cardiac failure again. When he came to the Heart and Health Center in Durban North, he could walk maybe 10 meters with severe shortness of breath, chest pains. He had a very poor quality of life. We went through some tests with him, clinical assessments, plotted out a management protocol for him. And after treating him, he has returned back to his quality of life. He's gone back to work, and he's very happy with his treatment and his future, basically, because he's quite a young person.
Wonderful. Doc, apart from heart disease, what other patients do you commonly see?
I think maybe people may be surprised to hear that, we treat many other illnesses except heart disease. But the underlying factor with most people is that we're talking about the people who are slightly on the elderly side, is that blood flow starts to decrease. When blood flow starts to decrease, it affects every part of the body, not just the heart, not just the legs, every part of the body. So that's why we focus a lot on heart problems. But we can scan and treat anybody from 3 years old right to adults. So we've treated successfully children who had problems, babies who had problems, right to the adults and old age. Patients who got no options, patients who have been through everything, and they find they have no quality of life. They feel that they've come to the end of the road. We'll be able to help people like that, and we've done it successfully. We don't like to say to any patients, and I've always said it in seminars and when I'm doing workshops and lectures nationally and internationally, that as medical professionals or healthcare professionals, we should never say to a patient, there's nothing more that can be done. We should say to patients, there's nothing more that I can do. So that patients will look for something else out there. Medical technologies are advancing at such a rapid rate. There's always something that can help somebody. So we may not know everything. So it's fair to say, I've come to the end of my road with you, and I've helped you as much as possible, but maybe there's somebody else that you could look for that would help you, or there's something else that would help you. And this would give a very important thing to a person, and this is called hope. And hope is sometimes all patients have. And we've seen patients who've been told this numerous occasions, and they've gone back to the quality of life, and they're driving today and gone back to their business. So let's focus on getting you better. Let's see what we can do for you. We've done it for many people. Don't look at the patient and say, we've been told by doctors there's nothing that can be done, because there's always something that can be done.
Doc, in closing, what is one message you want every listener to remember today?
I think there's more than one message, but the crux of the idea is there. Don't wait for a healthcare crisis before you start taking your health seriously, because many chronic diseases occur silently, and they can damage you in the long run. Small changes, lifestyle changes, healthcare assessments, appropriate treatment modalities improve your health status in the long term. So invest in your prevention of disease today, and it'll reap the benefits for you tomorrow. Remember, your health is your greatest wealth, so protect it.
Dr. Rakesh Mohanlall, a clinical technologist specialising in cardiovascular perfusion and non-invasive integrated healthcare, also offering you 50% for the second person doing the test. Thank you so much for your time this morning, Doctor.
Okay, thank you. It's nice being here. But again, it's only till the 9th of August, until Women's Day. So, if you want to undergo preventative assessment, if you have concerns about your health, if you want more information, if you want to look after your family to ensure a successful, healthy life going ahead, so you can contact us, and even for an appointment, and our staff will be more than helpful and happy to help you in any way we can.
Give us that
Thank you once again,
Doc, before you leave us. Give us that contact number before you leave us.
Okay. The contact number is 031 563 0419. So we are in Durban North. Again, the contact number is 031 563 0419.
Thank
You
you.
never know. Save the number. It may be for you or your family or friends or anybody you know.
The phone's
God bless.
ready.
It's always nice to be on.
Thank you, Dr. Rakesh Mohanlall. We'll keep in touch.
Join us again tomorrow morning on TBR.